Great to have Dr. Orit Holtzman from Compass Lifestyle Clinics and Paul Mavor from Health House. I'm going to let the two of you introduce yourselves before we jump in to discuss, the product's dosage and what we know with medical cannabis at the moment. Orit, if you would like to begin.
Thank you, Emily. Thanks for having me today. So I'm a medical doctor with special interest in functional medicine and medicinal cannabis. I'm into my second year of prescribing now, and I'm working in Compass Lifestyle Clinics in Sydney and the Blue Mountains. I have more than 200 patients that I manage their medicinal cannabis for them at this point in time, and I feel very privileged to be a part of this space. Before going into medicine, I was a neuroscientist, so I have a very keen interest in the research side of things as well.
Great. And Paul, if you would like to introduce yourself.
Hey guys, thank you for having me today. I'm Paul, I'm a pharmacist for Health House International, and we wholesale medicinal cannabis to pharmacies and researchers in Australia and the United Kingdom. I'm also passionate about education, and a lot of what we do is outreach to health professionals and the public, stating exactly what cannabis is capable of and where it sits in forums such as this.
Great. So I think we'd start the panel discussion talking about, that the majority of products on the market at the moment are sort of so-called guest formulations. And just wondering what does this mean for doctors and patients that are looking to prescribe a particular product to treat a particular condition or a symptom?
So I think that's been touched on in the previous panel as well. The conventional view of medications is, like I said, you would like to use a specific product for a specific indication in specific dose. Medicinal cannabis is a bit different. It's very personalized preparation, and different people respond to different ratios and different formulations in a different way, depending on their endocannabinoid tone, their genetic variations of metabolizing the different cannabinoids. So I think while it's possibly can be difficult when we're used to practice medicine in a bit of a different way, we need to move away from trying to pinpoint which product will work for which condition, and more work with the person and listen to them and how they respond. Having said that, there may be in the future, we would be able to compare and say, okay, well, for anxiety, most people respond better for CBD to CBD predominant formulation. So that would be our starting point. But at the moment, we just really need to practice it in a personalized way.
So absolutely, a lot of the formulations are guessed, but thankfully there's a lot of research going on, a lot of research happening here in Australia to try and narrow down some of that science and make it a bit clearer what's going on. But medicine isn't black and white. There's a lot of grey area, and there's a lot of patients using cannabis formulations for things which nothing else works for. In the case of drug-resistant epilepsy, there's this huge portion of patient, between 30 and 40%, that none of our 10 conventional treatments works. And for a portion of those, medicinal cannabis can greatly reduce seizures or give them seizure-free. For some, it doesn't work either, but it's part of the journey in cannabis that we are getting close, and we are trying to narrow it down.
Yeah, and so something that we've heard already today is in regards to patients accessing cannabis from the black market. Could you give us a bit of a background on the differences between medical cannabis that a patient may be accessing illicitly from the black market when they come to a doctor, seeking a legal prescription to move over into the legal framework? Could you tell us, I don't know, Orit, if you've had this experience, but how you would approach something like that?
Yeah, so I have quite a few patients that came to me after using medicinal cannabis from the black market. And the main thing is when you use a product from the black market, you don't really know what you're using. So the fact that something, even if there is a label and it's stated on the label, it doesn't mean that the product actually contains what it's meant to be containing. And the Pelican study was mentioned before. Some of the products do not even contain cannabinoids. Products that are meant to be CBD only do contain THC. And I do have patients that purchased what they thought was CBD only and then described a feeling of, getting extremely high from that product. So obviously it was not CBD only product. So that would be the main issue. Also, one batch may work fantastically well for a patient and then the next batch won't, because you can't really guarantee the consistency of those products. Also, the products that are prescribed legally, because they have to be analyzed, they have to comply with GMP guidelines. You do know that they are not contaminated by heavy metals, by molds, by bacteria. So you do have that guarantee of quality. When transitioning a patient from black market to a medically prescribed product, because it is really impossible to know what they've been using previously, basically need to start with them. So that's my approach, at least. I start like I would with anyone else, with the same approach of start low and go slow.
Yeah.
I would agree with Orit there that black market cannabis, you don't know what you're getting. And of course, it's cheaper to make anything when you don't pay taxes. But Emily, I'm sure you'll be familiar how much the legal products are tested, and you're giving them to chronically ill patients. And these patients, you can't afford to give pesticides or heavy metals, and you need to give the same dose from batch to batch. You simply cannot do that with something that has not been tested. There used to be a big price difference, but legal product is coming down a lot in price as the patient numbers grow. And not only that, we're starting to see subsidies. So if you're not getting a legal product, if you're getting black market product, there's no possibility of you getting subsidies from things like repat, which they were talking about on the previous panel, or even some of the private health insurers are starting to see the cash flow positive benefit in subsidising patients' medical cannabis because it's keeping chronically ill patients out of hospital. But the legal product has more people working in the quality control section than, in most cases, in the cultivation section, and it's a big part of producing a product to make sure it's safe for patients.
Yeah, definitely, Paul. I can definitely confirm that when we are growing the cannabis, there's a lot more regulations, there's a lot more checks, there's a lot of, third-party lab testing to make sure that that product is safe and that it is exactly what it says it is, and that the shelf life, if it's got a 12-month expiry, for example, it means that, that oil or that flower still contains the correct amount of THC and CBD that it had on day one, as it does, the day before the expiration date. So it is definitely a safer alternative, and also one where you know exactly what you're getting. And you do raise a good point. Some of these people are immune compromised, or they've got health conditions, and we really don't want to be taking these risks. And so it's important to try and move these patients over from the black market into the legal market. And I personally have had an experience with a patient just recently who is looking forward to at least having consistent supply of the same product, because even though they were accessing it from the black market, it's not consistent from one month to the next. And I think that's really important in the treatment of patients. If they find something that works, then they need to know that they can get that again and again, and that it's quality approved.
Absolutely. I can just add something, Emily. I have quite a few autistic children, and those children are so sensitive. So for them, it's especially important, like with the immune compromised patients, that the products won't be contaminated with heavy metals, and that consistency, any change is, their nervous system really reacts to any little changes in what their intake is. So those changes from batch to batch can be very detrimental for them. And unfortunately, often those families feel so desperate they do access black market oil. So that transition is extremely important for them.
And I probably want to then touch on, while we're talking about sort of, you know, some of these different products, is your opinion on the differences and the effectiveness between isolate-based products, so THC or CBD isolates, and then the full spectrum extracts, and then of course looking at cannabis flower. I know we touched on it a little bit in the previous panel, but I'd like your opinion as well.
Sure. So, look, while there isn't really much evidence on the superiority of full plant extract versus isolate, I personally believe that full plant extract is superior due to the minor cannabinoids, the terpenes, the flavonoids, so the entourage effect that's already was mentioned, I believe. The sum, the total is much greater than the sum of its parts, in my opinion, in this regard. So I would always prefer to use a full plant extract rather than isolates. And the flower is obviously the most natural way to use cannabis. That it's not processed in any way, nothing is taken out. Oil has its place, of course, because of the difference effect of ingesting the cannabinoids rather than using the flower for vaporizing. But I believe that having those full plant formulations are very important. And the only issues, I guess, that we have with the full plant extract is with that THC in a certain amount will be always present, and that's the issue with driving. So because driving is illegal with any amount of THC in your blood or saliva, then sometimes in these cases you do need to use CBD-only preparations.
And thankfully, most of the products on the market in Australia are full plant extract. There's the very large majority are. And I think that's important because there's so much more we need to learn about some of the minor cannabinoids, which are there in small, albeit microdoses. But I think in years to come, we're going to be hearing a lot more about some of the terpenes and their influences on efficacy, as well as some of the minor cannabinoids like CBC, CBG, and CBN, just to name a few. But they're there in trace amounts. They're obviously doing something that needs to be researched a lot more. But with isolates, you're just simply not getting those little extra bits that we're not quite sure at this stage what they're doing. But if it was me taking a product, hey, I'd want those little extra bits that we know that are safe and they're perceived to be doing something. But yeah, once again, it needs a lot more research in this area.
Yeah, great. We've actually just had a comment come in from one of the symposium participants who says they definitely feel better on a full spectrum extract, and it works a lot better for them to reduce their anxiety and reduce the other pharmaceuticals that they were also taking once they switched from an isolate to a full spectrum. So it's always good to hear those anecdotal stories as well. In regards to, at the moment, I guess mainly in Australia, we are looking at, the oils and flower for vaporization, and we're starting to see some other novel delivery methods, coming into the space in Australia. What kind of influence do you think these additional formulations and delivery methods are going to have for physicians when they're looking at prescribing products, perhaps instead of or as a complement to the oils or the flower for vaporization?
I think it's fantastic to have more options and more flexibility in prescribing. I'm personally really looking forward to having some topical creams or transdermal formulations for topical pain and for kids that struggle with taking anything orally. Some of them may not replace the oil. I think the oil would probably stay as the major method of delivery and as a foundation because of the longer activity time. But there definitely creams as an add-on, meter-dosed inhalers could be quite beneficial as a form of inhalation that is more well controlled than the vaporizers that we're currently using. So I think that's very exciting, and the more options we have, really, the better.
I'm also really geeking out on some of the new dosage forms coming to market, and I do see the flower and smoked or vaped cannabis as a thing that was popular in the past. But if you look at the blood levels, they give not very good sort of levels. They get a massive amount straight away, and smoking is probably not appropriate for the very elderly who've got poor lung function and quite young, and people inhale different amounts of smoke into their lungs. Oils are great, and it's an effective means for doctors to titrate upwards, and that's where we are now. But there's some really exciting acid-resistant capsules coming to market, and the other dosage forms. I'm also really excited about the topicals because there's so many CB2 receptors in the skin, and I've seen them be quite effective overseas, and there's not really that many products on the market yet in Australia, but I think once they will be, they'll be extremely popular, particularly for sort of chronic pain, so that they can put on in certain areas. I think they'll replace a lot of other things. But also, if you look at the elderly, they are on a lot of other medication, and they often get their medication packed. It's hard for them to open the adult-proof bottles. It's easier for them to have their capsule given to them, say by the carer, rather than sort of put under their tongue, because it's if they can get good blood levels by just taking a capsule in a unit dosage form, I think it's going to be far more convenient for the large majority of patients.
Yes, or even patches. If we can have transdermal patches for elderly patients, that could be a wonderful delivery method as well.
One of the problems with patches, though, a lot of people are either hairy, they don't stick, or they're allergic to the adhesive, so that is an issue as well. But yeah, I know with say smoking cessation patches with the nicotine in, they're an option, but they're not super popular. People quite often prefer to just swallow something and be done with it.
Mm-hmm. So we've also had a question come in earlier today asking about the difference between cannabinoid-based and the synthetic cannabinoids in medicine, and specifically asking in relation to the new proposed rescheduling of CBD that we might see early in 2021. Do you have any comments about the cannabinoid or synthetic cannabinoid medications? And it's probably a double question. And then in relation to the CBD that's going to be available hopefully over the counter next year.
And so I personally don't prescribe synthetic cannabinoids. I prefer natural. I mean, cannabis is a plant, and I think we should use it as a plant. They are used in research areas quite often. It is easier to control a synthetic molecule, but I think that nature is superior, in this case at least, to man-made molecules, and that ties in with the full plant extract as well. So obviously synthetic molecules will be just an isolated molecule, and you won't get all the extra benefit from the other component of the plant. What was the actual question regarding the rescheduling?
The question was, the difference between the cannabinoid-based and synthetic versions for the proposed rescheduling of CBD that will be available hopefully next year, all going ahead.
So I'm not sure what's if there is a
question there.
Yeah, it's more, I think they're just more asking the question in relation to the CBD that will hopefully be available over the counter next year, which I might, which maybe leads me into, what your opinion is and how you think the landscape's going to look in early 2021. Do you think we will have CBD rescheduled to a Schedule 3 and will be available obviously as a registered medicine over the counter?
Absolutely. If I was a betting person, I'd laid money on it. I mean, the amendment was proposed by the TGA. It cannot lose, in my opinion. There's something wrong if it did, because it's very well tolerated, and it's available over the counter in countries such as the United States, Canada, throughout most of Europe. I think it's a foregone conclusion that you're going to see CBD of all forms, synthetic or full plant, available over the counter, sold in pharmacies without a prescription. I think that'll be really good, that patients can access that, because you're seeing upscheduling of things like codeine, which a couple of years ago was made prescription only. And we know CBD is relatively safe. It's got very few interactions. It's really well tolerated. And if they need a higher dose, then they can go and see their friendly GP or local doctor that specialises in medicinal cannabis to have higher doses of CBD or something containing THC.
Yeah, great. I hope all that goes ahead and that we actually have products that are registered and available as soon as that comes into effect. I just wanted to touch on a point that was raised early this morning, and Orit, you mentioned it briefly as well in regards to THC-containing cannabis medicines and driving. I know there's been recently some media with a magistrate from New South Wales who has recently resigned from his position, particularly in regards to the drug driving laws that really do test more for trace amounts in your system as opposed to whether or not you're driving under the influence. How does that work with your patients in regards to those taking THC medicines? And do you see these drug driving laws changing anytime soon to accommodate medical cannabis patients?
So unfortunately, the laws at the moment, as you said, they don't test for impairment, just for the presence of THC. So I do need to advise all my patients that taking formulations that contain any amount of THC that they should not be driving. And that obviously makes it quite difficult for them, as driving is part of daily life. So it's either they don't drive or they do drive and take the risk of being charged with driving under the influence of drugs, which is an offense. I do hope the laws are going to change. I believe they are going to, especially with the down scheduling of CBD formulations, which may contain up to 0.3% of THC. Once you have this available to the public, there will be even a larger push to amend the laws so they do test for impairment like they do in Canada, rather than just for any presence of THC. The laws in New Zealand are already meant to change in 2021, so there will be testing for impairment, and also there'll be some kind of a level that is comparable to the alcohol level that is meant to produce impairment, rather than testing for any presence.
Yeah, I also can't see the laws changing anytime soon. We've got 6 states of Australia with 6 different drug driving laws, but generally the golden rule of thumb is if you're impaired, not to get behind the wheel, and if you are impaired, then wait at least 6 hours before you drive. But you know, I think Canada and New Zealand have got the best practice where they do test for impairment. They do a roadside sobriety test where they walk upon the line and put their fingers on their nose, and if they suspect someone's impaired, then they might follow that up with a blood test if they feel it's appropriate. But you know, it's hard to test because THC in particular is fat soluble, so it's in your body for up to 2 months, whereas you may only be taking trace amounts, as you mentioned, or you may be taking it medically in microdoses and absolutely not impaired. And thankfully, there's some really good studies. I know at least 2 studies being undertaken in Australia. I know Lamberts are doing some work in that area. So hopefully that'll clear things up a little bit and make it a bit easier for some of the regulators and to change their policy.
Yeah, great. Thanks for your feedback. We do hope to see those roadside drug tests be more relevant for testing if the driver is actually under the influence. And I'm just going to take one of the questions that has come in a little bit earlier during our discussion, which is from someone asking, you know, what your recommendation would be for using cannabis for cramps or period pain. Maybe Orit, you would be best to answer this. I don't know if you've prescribed in your practice.
Well, so, you know, every person is different, so I can't really give like a general advice on how to use it over a forum like this. and like with any type of pain, medicinal cannabis is not first line, so the patients need to have tried conventional treatment before trying cannabis. And if that has failed or was intolerable, then we can apply for approval with the TGA for treatment with medicinal cannabis. It can be helpful for cramps and premenstrual pain, and even Queen Victoria used it for that. So it definitely has the potential to help, but every person is different. So it really has to be assessed on a case-by-case basis.
Yeah, which really continues to bring us back to this personalized medicine. So in that instance, how would a new prescribing doctor develop a comfortable titration routine for new patients, no matter what the indication was that they were treating?
So for that, the main principle is start low and go slow. So you start with a low dose and titrate up slowly in order to prevent any side effects, and also to find what's the minimal optimal dose that is optimal for every patient. For new doctors, I think it's really important to get some education and training. So I'm very lucky to work as a medical educator with Marijuana, and we provide training for new prescribers. And we're also in the process of establishing a college with Dr. Teresa Talpik and John Tay that have been previously. And one of our main goals would be to support new prescribers with having a certification and guidelines on how to prescribe. But really, as I said, the main principles are start with a low dose, go slowly, get familiar with just a number of products that you feel comfortable prescribing. And that's how I start. With gaining more experience, you can branch out more to more products. But if you keep it low and keep it low and slow, then it's very difficult to go wrong with cannabis.
So most of the drug companies have got titration schedules, particularly for the oils, as an example to use, where patients might start off on, say, 0.25 a ml of a product a night, and over 2 weeks increase it up to, say, a twice a day, 3 times a day dose, anywhere up to 1 ml sort of 3 times a day, 1.5 mils twice a day. That's really easy for the doctor to follow and the patient as well. At the moment, the theory is start low, go slow, but I see as we get more further along the line and with some of the unit dosage forms, I think you'll see a time in the not too distant future where patients are just put on a certain dosage for a certain condition. In the way you take 2 paracetamol 4 times a day, I can see that happening with cannabis as well.
My approach is actually a bit different to that. So just from clinical experience as well, some people, and it doesn't even have to do anything to do with weight or age. I don't think you can approach it in the same way you approach paracetamol. So some people on, let's say, a 10-10 formulation would respond very well to 0.25 and will experience side effects once you increase even more than that, while others will need a 1 meal 3 times a day. So I think it's very difficult to dose it in the same way you dose other medications, because the response is so personal.
Yeah, and it's true as well, isn't it, in regards to building up a tolerance. So maybe, especially with the THC-based medicines, taking 0.2 of a mil to begin with you might have quite a few side effects, but after titrating up over the course of a week or a matter of weeks, you're able to take, a much higher dose, without having those side effects.
That's right, and that's why I believe that I do believe in giving patients access to at least low dose CBD products, but also I do believe that having the support of a practitioner that is experienced with medicinal cannabis is very important in order to optimize the management and minimize side effects.
Definitely.
Yeah, definitely. Okay, and I've got a question that's come through on the chat that's asking, has anyone looked into nasal delivery spray in a hydrosol base? Don't know if you've seen this at all, Paul, in your world travel.
I haven't seen them yet, yeah, no, different things work for different people. I mean, the main issue with dosing medicinal cannabis that you're bypassing the stomach, so the acid in the stomach. But I've not seen any pharmacokinetic data on nasal delivery. But yeah, once again, it may not be for everyone squirting something up their nose.
Sure. And I guess we've only got a couple of minutes left. I wonder if you have any closing remarks, or, you know, where you see the future of the medical cannabis industry in Australia, and the products that we might see, you know, moving into 2021.
Topicals. Topicals. I'll just say I think we're actually on a really good pathway. That initially a lot of the regulators were really concerned there'll be diversion or people just taking cannabis to get high, but I think they were some of the first people to actually witness some of the really good patient outcomes under our medical system, whereby a prescriber is prescribing something, managing the patient, the pharmacists are then counselling them. There's some GMP quality cannabis being done. We've got really good research. And the patient access has got a lot easier from what was a 2-month process initially. So we've seen some approvals come through as fast as 3 minutes, and they're now allowing GP prescribing. They're not making the additional state approval. The TGA have been really efficient that way. And we're on track for, I think, 100,000 patient approvals this year. And pretty soon, probably in 3 to 4 years, I think we're going to max out at 300,000 patients in a similar number to what Canada achieved. They achieved 400,000 medical patients before they, which is where they sit. But I think Australia's on the same pathway where we're doing pretty well. And thanks to educational events like this, which is, we can't do enough of them, but it really does help educate medical professionals and the general public.
I think we'll see as more and more products, type of products and methods of deliveries, and I think cannabis will come more into the mainstream. There is a huge interest within GPs and even specialists in learning more about medicinal cannabis. I get more and more doctors that are actually referring to me, and even specialists, so pediatricians, neurologists, psychiatrists, and that's very encouraging because many people can benefit from medicinal cannabis. So it's wonderful to see it getting more and more accepted in the mainstream medicine, and I think that's just going to grow.
Yeah, and I think you're right. I mean, a lot of people talk to me about it being an alternative medicine, and I think, you know, we're definitely starting to see it. That it's not an alternative medicine, it's a mainstream medicine. And we are, you know, as Paul said, you know, events like this that are just helping educate doctors, patients, anyone who wants to listen, because we've got a huge, you know, stigma to remove from the cannabis plant, and so that we can accept it, you know, as a beneficial therapeutic product. And it's just another tool in our toolbox when we're looking at treating a range of symptoms. So I'd really like to thank you for joining us today, Orit and Paul. And I'll hand over for the research panels for the rest of the afternoon. Thank you.
Thanks, guys. See you later.
Having us.